Hello everyone. In this class, we'll try to learn about what is hypertension and hypotension. Learning objectives of this class would be to give values of blood pressure in normal persons, prehypertensives and hypertensives, list the risk factors for hypertension, classify hypertension and give the important causes of secondary hypertension, understand the ill effects of hypertension on body systems, appreciate the physiological basis of treatment of hypertension, and classify hypertension and give their common causes. Hypertension. Hypertension is defined as sustained elevation of systemic arterial pressure. Change in systolic pressure, unless persistent for a longer period, is not considered as hypertension. Such a rise in systolic blood pressure is pre-qualified as systolic hypertension. The degrees of hypertension based on the levels of diastolic blood pressure, it can be normal when the range is 60 to 79 mmHg. It is pre-hypertension when it is between 80 to 89. It is mild hypertension when it is between 90 to 104. It is moderate when 105 to 115, and if it is severe, more than 115 mm of Hg. And systolic hypertension is normal when it is between 100 to 119. It is pre-hypertension between 120 to 139 mmHg, and it is isolated systolic hypertension when it exceeds more than 140 mmHg. Another joint national committee classification of hypertension is normal is when systolic blood pressure is less than 80 and diastolic less than 80. Pre-hypertension, systolic between 120 to 139, diastolic 80 to 89, and there are stages of hypertension: stage 1 and stage 2. Stage 1 is systolic between 140 to 159 and diastolic between 90 to 99, and stage 2 is when SBP more than 160 and diastolic more than 100. Hypertension broadly classified in two categories: essential and secondary hypertension. Essential hypertension is also called as primary hypertension. This constitutes about 90% of all hypertensions. The risk factors for hypertension are the hereditary. Hypertension is inherited as a Mendelian dominant. Both the parents are hypertensive, chance for children is more than 50%. One of the parent is hypertensive, then chance is 25%. The blood pressure increases with age. Age-related rise in blood pressure is due to increased arterial wall thickness and degenerative changes in the arteries and arterioles. Hypertension is less common in females before menopause due to the effects of gonadal hormones estrogen and progesterone. Estrogen decreases blood cholesterol and slows the process of atherosclerosis. Thus, estrogen decreases the blood pressure. Progesterone causes relaxation of the smooth muscles and therefore produces vasodilatation. Black Africans are more prone to develop hypertension. Stress causes vasospasm by inducing sympathetic activity. Stress also causes hyperlipidemia. Thus, stress disposes to hypertension, ischemic heart disease, and other cardiovascular diseases. Chronic smoking increases nicotine and carbon monoxide concentration in plasma. Nicotine and carbon monoxide are potent vasoconstrictors. Nicotine also increases the secretion of catecholamines. Obesity increases the susceptibility to hypertension. Reduction in body weight by 1 kg reduces the blood pressure by about 2 mm of Hg. Hyperlipidemia facilitates the process of atherosclerosis. Sedentary lifestyle, like lack of exercise, is known to produce obesity and hyperlipidemia. Type A personality, that is where they have a more sympathetic activity, they're more prone for hypertension. Environmental factors like their occupation, family size, crowding, that is also going to influence the blood pressure. Salt intake and salt sensitivity. Increased salt intake and salt sensitivity of the individuals increase the blood pressure. And chronic uh, excess intake of alcohol also going to increase the blood pressure. Secondary hypertension, hypertension that occurs due to various diseases, is called as secondary hypertension. Secondary hypertension is classified into following categories. It could be renal, it could be endocrinal, it could be neurogenic hypertension. Some of the causes for renal hypertension are glomerulonephritis, pyelonephritis, polycystic renal disease, renin producing tumors, and renal artery stenosis. Some of the endocrinal reasons for hypertension are adrenocortical diseases like hyperaldosteronism, Cushing's syndrome, hypertensive form of congenital virilizing tumor, pheochromocytoma, acromegaly, and myxedema. Some of the neurogenic cause of hypertension are acute increase in the intracranial pressure, polyneuritis, and diencephalic syndrome. Other forms of hypertension are the pill hypertension. Oral contraceptives cause sodium and water retention from kidney and also increase the release of renin, causing hypertension. Severe polycythemia, pregnancy induced hypertension. Pregnancy induced hypertension is seen in complicated and risk pregnancies in which placenta produces pressure peptides or blood vessels become hypersensitive to the circulating vasoconstrictors. Then there can be miscellaneous cause can be coarctation of aorta, hypercalcemia, increased blood volume, or glucocorticoid therapy. Then experimental hypertension. Hypertension produces in animals uh, by various experimental techniques. Like there can be renal hypertension. Constriction of the renal artery by applying clips produces hypertension, which is called as Goldblatt hypertension. This type of hypertension is cured by removing the constriction from the renal artery. When one renal artery is clipped with other kidney intact, hypertension is due to high renin production in the uh, clipped uh, kidney. Then neurogenic hypertension, denervation of the carotid sinus and aortic arch or bilateral lesion in the nucleus tractus solitarius leads to hypertension. Then it could be due to the steroid induced hypertension, glucocorticoid or mineralocorticoid. Then partial adrenalectomy, salt induced hypertension in salt sensitive rats can produce hypertension. Effects of hypertension on the cardiovascular system: it increases the peripheral resistance, increase the afterload on the heart. Compensation for the increased excessive workload on heart occurs by uh, first concentric left ventricular hypertrophy, followed by dilatation of the cavity occurs, which results in heart failure. Myocardial oxygen requirement increases due to an increased ventricular mass. This causes angina pectoris and ischemic heart disease. On the blood vessels, uh, the hypertension produces the stiffness of the vessel wall and decreases the vascular compliance. Hypertension promotes atherosclerosis and decreased vascular compliance, uh, where the blood vessels become stiff due to the increased smooth muscle in their walls in response to chronic wall stress. And because of the atherosclerosis uh, and, and decreased compliance of the vessel wall results in narrowing of the lumen. Hypertensive patients are predisposed to cerebral thrombosis and hemorrhage. Its effect on CNS, cerebral vascular microaneurysm, results due to the hypertension, which is also called as Charcot-Bouchard aneurysm. Increased arterial pressure and vascular microaneurysm results in cerebral hemorrhage. Severe chronic hypertension causes hypertensive encephalopathy and retinopathy. On the kidney, arteriosclerosis of the renal vessels and afferent and efferent arterioles of the glomerular capillaries can occur, and this decreases the GFR and globular or tubular function. Proteinuria and hematuria are not uncommon. Then the management. So initially, the lifestyle has to be modified. Weight reduction of 1 kg of body weight, the blood pressure decreases by about 2 mm of Hg. Some of the dietary modifications like salt restriction, restriction of the fat, increase fat content, uh, where salt restriction decreases the blood pressure in salt sensitive animals. In human beings, it is difficult to know the sensitivity to salt. Therefore, currently salt restriction is advised to all hypertensive patients. Restriction of the fat, especially the animal fat in the diet, decreases the process of atherosclerosis and therefore reduces blood pressure. Increased fiber content controls obesity and hyperlipidemia. Fibers in the diet decrease the absorption of the fat from the intestine and therefore prevent hyperlipidemia. Regular physical exercise is the best uh, form of exercise for reducing blood pressure. uh, is the brisk morning walk at a speed of 25% or more than a normal walk, about 30 to 60 minutes. Regular exercise controls blood pressure by decreasing the sympathetic tone and increasing vagal tone. Mental relaxation, like change in the temperament, relaxation exercises, yoga therapy are known to decrease the blood pressure in hypertensives. Mental relaxation improves the condition of the patient by reducing sympathetic discharge. Happiness of the mind is a prerequisite for a healthy life and for maintaining normal blood pressure. Stoppage of alcohol smoking must, I mean, it is also going to help in the treatment of hypertension. Some of the drugs which are used for hypertension are anti-adrenergic drugs, that is beta receptor blockers and alpha receptor blockers. Beta receptor blockers like propranolol and atenolol. First, they're the first line of drugs which decrease the blood pressure by blocking sympathetic effects on heart and decreases heart rate and cardiac output. They also reduce adrenergic nerve mediated release of renin from JJ cells, which lowers the blood pressure. Alpha blockers like phentolamine decrease the blood pressure by blocking the action of norepinephrine on blood vessels. They also decrease the release of norepinephrine at the sympathetic nerve endings. Diuretics like thiazide diuretics produce sodium diuresis and volume depletion and also reduce peripheral vascular resistance. Whereas loop diuretic furosemide, uh, it is also going to decrease the blood pressure. Aldosterone receptor blockers like spironolactone decreases the effect of mineralocorticoid activity on kidney and causes renal sodium loss. And it is effective especially in hypertension due to the hyperaldosteronism. Then AC inhibitors like captopril, enalapril inhibit the action of angiotensin converting enzyme, which reduces the production of angiotensin 2. They all retard the degradation of bradykinin, a potent vasodilator, and also reduce the activity of adrenergic nervous system. These drugs are especially useful in the treatment of renal or renovascular hypertension, malignant and accelerated hypertension. In calcium channel blockers like verapamil, amlodipine, nifedipine, diltiazem inhibit calcium entry into the cells by interacting with specific binding sites on alpha 1 subunit of L type of voltage dependent calcium channel, decreasing the vascular tone that in turn decreases the blood pressure. So the drugs like angiotensin 2 receptor blockers like losartan, valsartan, telmisartan block the angiotensin 2 and 81 receptor subtypes. Some of the vasodilators like hydralazine, minidoxil decrease the blood pressure by directly causing relaxation of the smooth muscle. Coming to hypotension, hypotension refers to decrease in systolic blood pressure. When systolic blood pressure is less than 90 mm of Hg in adults, this condition is known as hypotension. Clinically, they can be three types of hypertension: chronic hypertension, acute hypertension, or postural hypertension. Chronic hypertension is characterized by persistent low blood pressure. Some of the causes are primary adrenocortical insufficiency, hypopituitarism, malnutrition, chronic diarrhea, and prolonged bed rest. Acute hypertension is usually associated with the fainting. Some of the causes for acute hypertension are acute hemorrhage, acute diarrhea, severe vomiting, acute myocardial infarction, excessive diuresis, and acute vasodilatation. Postural hypertension (SBP) falls by 20 mm of Hg or more when subject assumes erect posture from supine. It is called as postural hypertension. It may be acute or chronic type. Acute postural hypertension is due to the temporary fall in the blood pressure that may result in transient fainting. It is usually seen in following conditions like prolonged standing, getting up from the bed after prolonged illness, and strenuous physical exercise. Chronic postural hypertension can be primary or secondary variety. Chronic primary postural hypertension, where it is also called as idiopathic, it occurs due to the degeneration of the peripheral autonomic nerves. And chronic secondary postural hypertension, this occurs because of the polyneuropathy which are seen in diabetes, amyloidosis, and beriberi. They are also seen in autonomic neuropathy, as seen in syringomyelia, tapes dorsalis, and subacute combined degeneration of the spinal cord. And also patients receiving sympatholytic drugs and also after surgical sympatherectomy. This is in between, in brief about hypertension and hypertension. Thank you.